from Trach Care. First, I'm gonna perform hand hygiene. Alright, I'm gonna gather my equipment. I have a trach kit, trach holder, mask with eyewear, clean gloves, hydrogen peroxide, normal saline. Alright, first I'm gonna go into my patient's room, identify my patient ×2, name and date of birth. Then I'm going to assess their respiratory status. Alright. And after that, I'm going to explain the procedure and let my patient know that if they feel any discomfort during this procedure, to just raise their hand and let me know. Alright. Now after that, I'm going to perform hand hygiene again. Alright. And now I'm going to put on my mask and eyewear. Alright. Now I'm going to loosen my caps with my normal saline and hydrogen peroxide. Alright. And now I'm going to open my trach kit. I'm going to take out my sterile gloves and sit them to the side. Take out my drape. Remain in sterile technique. Place it on there. And now I want to take my contents in my tray and dump them onto my sterile field. Alright. And now I'm going to take my hydrogen peroxide. First, if it's been previously used, I'm going to lip it. And then I'm going to pour some in there. Halfway. And now I'm going to take my normal saline. I'm going to lip it as well if it's been previously used. And I'm going to pour it in there halfway. And I'm also going to add normal saline to these other 2 trays as well, other 2 slots. Alright. Now I'm going to put on my clean gloves. Alright. Got on my clean gloves, so now I'm going to remove the oxygen application. I'm going to take the embu bag and I'm going to hyperoxygenate my patient for 3 to 5 breaths. 1, 2, 3. So after that, set my embu bag down and I'm going to hold the trach in place and I'm going to twist. Alright. Now I'm going to take my trach inner cannula and place it in there. Alright. And now I'm going to remove my clean gloves. And now I'm going to don my sterile gloves. Alright. Get my sterile gloves on. Alright. Now I'm going to separate my supplies. I'm from the sterile field, maintaining a 1-inch border. Alright, now I want to grab the inner cannula by the top part. I'm going to clean it, holding it over the hydrogen peroxide and normal saline section. I'm going to clean it inside and out. And once it's clean, I'm going to take it and I'm going to drop it in one of the normal saline portions of the tray. Alright, and once it's rinsed, I'm going to take it out. I'm going to tap it on the tray to get the excess water off. Now I'm going to place it back in. Alright, it's in there. And after that, we want to take one of these 4x4s or another gauze. We're going to dip it into the sterile water that hasn't been used yet. And we're going to clean the outside of the tray. Sweet. Sweet. Alright. After that, we're going to take the remaining gauze and we're going to dry it. Now, I'm going to clean the stoma, so I'm going to have to remove the dressing from the tray. Discarding it. I'm going to take one of the cotton swabs into the clean section of sterile water. I'm going to clean around the stoma. Alright. Now I'm going to dry what I cleaned around the stoma. Alright. Now that that's dry, I'm going to replace my trach holder. Alright. I'm going to run my trach holder through here. I'm not going to remove the old trach holder until I have the new trach holder in place. So now I'm going to remove the old trach holder. After that, I'm going to stick my finger in there, make sure that it's one finger breadth between the trach holder and the patient's neck. Let's discard that. And now I'm going to replace the 4x4, the dressing, back to the trach. After I do that, I'm going to reapply my oxygen. Then I'm going to assess their lung sounds, their respiratory status, check their oxygenation. Alright. Now I'm going to take off my sterile glove, or remove, well, not take off my sterile glove, but first I would discard all of my stuff, my sterile field and my trach tray. Now I'm going to remove my gloves. My eyewear and my face mask. Then I would perform hand hygiene again. Throw everything away. Now I would document the date, the time, the procedure, how well the patient tolerated it, any drainage, the color and consistency of the drainage, the respiratory status, and my signature. And that's it.